Another basic test is something we do in your mind, is to assess how much light are you receiving every day. Light is basically another basic nutrient that we need. We need light. The basic Western physiology of light, or sunlight, is vitamin D levels. Vitamin D levels, of course, are very important for health. Vitamin D is an anti-inflammatory. Everybody agrees that we need sufficient vitamin D. And to get that, we either need to get enough sun, which most people, especially those who listen to doctors, are not getting enough, because today doctors are scaring patients about sun and cancer, and they're giving them suggestions and recommendations for sunblock. Not only are the chemicals in sunblock, like everything else, not natural, toxic, but they're going to block your sun. Just so happens that the closer you live to the equator, the lower your blood pressure is going to be, because the higher levels of vitamin D you're going to receive. The closer you live to the poles, the lower the angle of the sun, that even when you go out in the sun, the less vitamin D you're going to receive. So I recommend to cancer patients that they should go out into the sun every day and get enough to get a little bit pink. Otherwise, if you live in a climate where you're not getting any sun, or you're sick in bed and you're not getting any sun, you need to know that, you need to assess that, and then you need to substitute vitamin D3 for sun exposure. Again, the amount of light that you receive is very important. The body happens to break down the cosmic light into the 7 colors, and that's why the color test works the way it does, because we live like a prison. We have, in physics, Roy G. Biv, red, orange, yellow, green, light blue, midnight blue or indigo, and violet centers, glands that are breaking down and absorbing the light as color. But in terms of vitamin D, we're talking about full spectrum light, talking about the sun, and you don't want to be deficient in that.